Hi, and welcome back to our Hyperdilute Radiesse series. If you caught our first two segments, you'll know that our first week we treated this patient's temples with a dilute Radiesse 1-to-1 ratio. The second week we treated her face for some volume loss in the mid-face. We also used a 1-to-1 ratio of 1 part diluent to 1 part Radiesse. When we are looking to restore volume, we are going to use a tighter dilution because then you still get that volume effect of your Radiesse, but you also get the biostimulation as well. For today's treatment, we are doing the patient's neck. And so we're no longer looking for volume in the neck, but we're looking for skin tightening and improving the overall appearance of the neck. If you see, this patient has fairly static creases forming in her neck. We call those necklace lines, or also known as tech neck. And so this patient's goals is to address some mild laxity of the submental area and then the necklace lines in her neck. And so we are using a bit of a different ratio here. We're using 3 parts diluent to 1 part Radiesse. So we do truly consider that hyperdilute Radiesse versus a 1-to-1 ratio would be considered dilute Radiesse. If you use 3 parts diluent, that gives you 4.5 cc's total, and 1 part Radiesse, which is 1.5 cc's of Radiesse, that will give you 6 cc's total for your treatment. And for this particular patient, I have 3 entry points that I'm going to fan my material. You can see I'm working on my first entry point here. This is the submental area, and to be honest, I think this is sort of the easiest treatment area. Your cannula just tends to glide really nice and easily, and you can generally fan that material in pretty quickly. I used a 2% lidocaine to numb my entry point, created a pilot hole, and then I'm using a Comfortox 25 gauge 50 millimeter cannula to fan the material into that submental area, and I'm giving her 2 cc's of my diluted Radiesse there. Moving on to the sides of the neck. So I just have 2 entry points for her. She doesn't have a whole lot of concerns in terms of the lower neck. And so we're sort of focusing on placing our material just through 1 entry point. And the technique is exactly the same. You numb your entry point, create that entry with your pilot needle, and then you're going to take your cannula and just fan your product out nice and evenly across that neck. When we go to treat the other side of the neck, then that will get her full coverage across the patient's neck. And so you can see here we are doing just that. This is this patient's second treatment of her 3 treatment series. At least we're going to try for 3 treatments, and then we will reevaluate at that point. I don't expect to see much in terms of results after only 1 treatment. We do our treatments 4 to 6 weeks apart, and as you all know, neocollagenesis does not happen overnight. We are expecting for her results to really peak 3 to 6 months from the start of her first treatment. A lot of patients will come back and say, things looked really good for a while there, and then it sort of went away. And that's honestly what we expect. We are placing a fair amount of fluid into the tissue for the procedure itself. And so what you're seeing that initial period after your treatment is just swelling. And then once the body sort of reabsorbs all of that fluid, you go back to your baseline. But what we hope is that over the course of the next couple of months, those are the results that we're going to get in place. That's really our goal. And so it requires patients to sort of understand that this is a bit of a gradual improvement. There's some patience needed here, and, hold out, and you're really going to love your results once you get to that 6-month mark. And so we have done exactly that with this particular patient. And she is a really great candidate, just looking to restore some volume in her face. And then again, the neck is just some skin tightening and addressing those static creases in the neck. Radiesse is a great treatment for the neck because as we age, not only are we losing collagen, but we are also losing elastin. And that contributes to a lot of that laxity in the neck. And so when we can sort of stimulate that elastin to produce, we can really improve the appearance of the neck as well, which tends to be an area that is oftentimes forgotten. Some people take really good care of their faces and neglect the neck. And in my opinion, that can sort of really show somebody's age. And so it's important that we're not only addressing concerns on the face, but the neck as well. The neck certainly has all of the same exposures in terms of environmental exposures that we have with our faces as well. And we see all of those changes of aging on the neck as well. So here's the last portion of our treatment for this patient. And we're just sort of advancing our cannula, again, in and out, fanning that product in a retrograde fashion, and just spreading it evenly across her neck so she has nice, even neocollagenesis once that process will take place. The AAFE will be teaching biostimulatory courses in 2023, and we really hope that we have the opportunity to train you in this awesome procedure. It is a great opportunity for you to address not only concerns of volume loss, fine lines, wrinkles, acne, scarring. Overall, it's just a really, really great treatment. So we hope that we have the opportunity to train you in 2023 on Hyperdilute and Dilute Radiesse. Thanks for watching our 3-part series. Again, if you have not previously viewed the treatment of her temples and her face, this would be a great opportunity to pop over to our earlier episodes so that you can watch those as well and see the complete treatment for this patient and sort of see how we address different treatment areas. Thank you so much for watching. We're just giving her a little last-minute massage, just making sure everything feels nice and smooth, no lumps or bumps, and then she's on her way out the door. No massage is required for the patient after this procedure, which is really great in terms of what is required for the patient on their end. Thanks for watching.